Hello everyone, I'm Vikas, and today we are discussing the physical preparedness, the medical preparedness rather, about upcoming Indian Oil WNC Navy Half Marathon 2024, which is scheduled on 17th of November. The race is fast approaching, and so our training is as well. We need to be, however, be very trained. We need to be aware of that we are medically and physically fit to be at the start line as well as finish our race healthy, happy, achieve our personal best, get to our optimal best, and be enjoying all of it. And for doing that, I have the pleasure of speaking with someone who's very special. And for that, we'll be traveling. Where? I am traveling together with my team to Jaslok Hospital, Mumbai. Jaslok Hospital is our medical partner for this year again. Huge thanks to them. And today, I'm speaking with its Director of Cardiology, Padma Bhushan, Dr. Ashwin B. Mehta. He is 84 years old. That's correct. He's 84 years old. He's been working for more than 50 years. He is someone who has done more than 20,000 angioplasties. He has supervised more than 100,000 angiographies. Who better than him to tell us about our hearts? Who better than him to give us some pieces of nuggets of information that will help us be safer, right? And so, let's join me in my excitement of meeting with Dr. Mehta and learn everything that he has to say. Let's go. Sir, welcome. It's an absolute pleasure to have you with us today, sir.
Thank you, Vikas. Pleasure is mine too.
Sir, this conversation is particularly about the half marathon that's coming up our way, which is Western Naval Command Half Marathon. It's scheduled in a few weeks, which is on 17th of November, and 19,000 runners are going to be at the start line very soon. And when we talk about runners, we think they're endurance athletes, they are strong, they are smart, and they have everything that it requires. And on the other side, there's a question that keeps coming up because of certain incidents and issues where there is something to do with the heart, and issues get flared up during training, or otherwise anecdotally we see and hear in the races that either there is a cardiac arrest or similar issue that gets known and people get scared. I wanted to request your help in understanding what's happening, why even if people have trained and then when they are running, why should they be cognizant of certain things?
Well, Vikas, first of all, we must understand that absence of symptoms is not the same as absence of disease. In other words, the disease can exist in you and might even progress without your knowledge because you do not have symptoms. And sometimes the first symptom in cardiac patients could be the last symptom of his life because it results into catastrophic outcome, and that's the death. Let us understand what happens. You know, when autopsy was done on Vietnam War soldiers who died, they found sticks of cholesterol in the arteries even at the age of 23 to 30. That means what? That the onset of coronary disease starts much earlier than you and I think. So, if that was shown by proof, autopsy proof, all right. Why do people don't have symptoms and the disease progresses silently? It's because of certain mechanics, physics. So, when the flow is across the coronary artery is obstructed until 50 to 70%, somehow or other, the defense mechanisms within the body does not allow to perceive deficiency of blood flow. Let me clarify. If my artery is 50 to 60% blocked, my stress test could be normal. I may not have any symptoms. I am capable of undertaking any exercises whatsoever, and therefore I don't find any need to go to doctor. And if the doctor evaluates me, even including stress test, he may not be able to detect any abnormality whatsoever. So this problem is not only enigmatic to people in general or society, but the medical fraternity also, because we want to prevent that to happen. We want to detect. And currently available investigative modalities are not sufficiently strong enough to be able to detect. So what we do, in principle, we weed out high-risk patients. High-risk patients are those who have multiple risk factors. And time and again, we have discussed about risk factors, the cholesterol, diabetes, hypertension, etc. So I would not go into a boring repetition of those. So when that block is existing, let us say it's only 30% or 50%, and as explained to you, is not sufficient enough to be able to produce symptoms. So asymptomatic but somewhat diseased person is moving freely, confidently in the society. When you do a strenuous activity, sometimes two things happen. Your blood pressure shoots up very rapidly and your pulse rate also shoots up very rapidly. And the multiplication of the pulse rate and the blood pressure, the combined product, when it goes enormously high, that silent block ruptures without your knowledge. And when it ruptures, immediately the platelets run there and the clotting cascade, the coagulation cascade starts. The blood starts clotting there. What was 30%, with addition of a clot there in the lumen, becomes 50, 60, and within a matter of few hours, 100%. And when 100% takes place, then the patient gets pain and it is the onset of heart attack.
Right.
And unfortunately, 50% of the people who get heart attack have no opportunity to reach up to the hospital. So we lose them. They have no opportunity. It's so rapid downfall that there is no opportunity for him to procure medical aid. So this is the reason. And therefore, at least we keep on telling people, persuading people that please learn cardiopulmonary resuscitation. That when the heart attack occurs and the cardiac arrest takes place, how to keep the circulation maintained so as to be able to reach up to the hospital where hospital doctor can do something. And unfortunately, when the cardiac arrest remains untreated for more than 3 to 4 minutes, irreversible brain damage takes place. So this is the issue. I hope I'm clear, Vikas.
Sir, very well understood. And I have subset of the previous question. This makes a lot of sense. Now, the next question comes in our mind as part of it is, how do I get it detected? How do I detect it? And why I say this is because historically, when I studied in my childhood, I studied certain subjects and I was never taught what blood tests, what other tests need to be done. As I grew, I went to a corporate, and in the company I was told you have an executive health checkup. It included certain blood tests, etc., and at times an ECG, and nothing beyond it. At times I remember once I went and I was told that you should do a 2D echo. I was further thinking, does it really detect the arteries blockage? Then what do I do?
Unfortunately not.
Sir.
The regular health checkup program misses out on this.
So,
because I told you, when the mild to moderate coronary disease exists, that means the mild to moderate blockage process is existing in the coronary arteries, by routine non-invasive methods. By non-invasive means in outdoor kind of methods, stress test, echo, maybe even a CT angiography, when they fail to detect significant disease.
even CT angio.
CT angio, I'll tell you about CT angio. Unfortunately, CT angio is comparatively more sensitive to be able to detect the presence of disease. But unfortunately, to apply CT angiography to a mass level, national level, is impossible.
Yes, sir.
Even America is not able to do that.
Yes, sir.
That each and every person should undergo CT angiography will require innumerable doctors, number of cath labs working around the clock, detecting. It can't. The population cannot be screened.
Yes, sir.
That's limited. So what we do, we at least try to weed out those who are at a higher risk. So those people who have a more than 2 or 3 risk factors.
So,
Let's say diabetes, smoking, and strong family history, or high cholesterol level, diabetes, and strong family history, whatever combination, they are observed a little more closely. So once in a while, a small hint is given to the patient, which he unfortunately ignores. He might experience a little bit of discomfort in the chest while trying to remove heavy luggage on the shelf. And then he might get some little bit of discomfort, which he might ignore.
yeah.
And therefore, those patients who are at high risk, we watch them very closely. And that's why. Because when I was in United States and I was investigating the health problems of school-going children,
So,
16% of the school-going children had cholesterol level of more than 300. Their cholesterol level is comparatively higher as compared to Indian people,
yeah.
and therefore, but what I'm trying to say that it's a myth that I must get checkup done only after 45, 50 because the coronary disease begins at that time only. No.
Right.
It's a coronary disease is a history of your lifestyle.
Right. Yeah. Very true, sir. And you also talked about the Vietnam War, the autopsy that was done, that further concluded that it would have started much, much earlier to even get the plaques, the blockages,
Right.
etc.
Like what we think in the society, or we sometimes assume
So,
that I'm still not 45,
I
so I should be free. Well, I'm not advocating that, or not. I'm not. Please be not. Don't misunderstand me in the sense that I'm not trying to create a panic or a fear.
So,
That if you're healthy, you're fine. Live your healthy life, all right.
Right.
But keep your lifestyle in such a way
right.
that you postpone, if can't prevent,
Right.
the onset of coronary disease.
Right. So,
You should postpone.
Yeah.
After all, we all are finite and mortal.
yeah.
So I'm not saying, but whatever is destiny written in your life, you should enjoy, and with a completely normal health.
Right.
That's my viewpoint.
So, totally. It is possible that some people have genetic predisposition. There could be some issues related to that, etc. What should be the start point? Listening to this conversation, I'm thinking from a detection point of view. I have seen, and I've seen in my family as well, sir, that is that people are in denial. It was very hard for my father to come to hospital and agree to the cholesterol number he was seeing. And he was giving me all types of excuses. And I have seen this is not an uncommon occurrence. Where do we start, and how do we start to make sense of these numbers when we see it in our blood tests?
So you asked me 3 questions in your single question.
Sir.
So first, family history.
Sir.
There are 2 uncorrectable factors. I can control diabetes, cholesterol, obesity, lack of exercise, stress, fine. Aging process also a risk factor. So the heart disease is more prevalent in elderly people, matter of common sense.
Yeah.
And family history, which is not a corrected. So these 2 are uncorrectable factors.
So,
And we'll have to live with them.
so,
We can advocate marriage counseling. There is 2 members, like 2 people making life, a wedding couple. If they both have on their side strong family history, then I would persuade to counsel them that this may not be a good idea,
right.
because the progeny, the children, will have a very high risk of coronary disease. It may be taken, it may not be taken, because if they're deeply in love, they're not going to listen to you and me. And the second question is that people who report late or denial mode
Yeah.
are 3 categories. Young people,
Yeah.
where they feel they're far away from heart attack. It's a disease of elderly.
Yeah.
Wrong. No more. 2, women. They don't report in time. They don't generally prefer to undergo full, complete checkup, especially from cardiac standpoint. So that's the second population, which we are now. We are little more. It was neglected subject by the medical fraternity also. Women, But now we are more aware. Now we are paying more attention to women's health. The third is very elderly people. They also are reluctant. They feel that they'll detect something, and the fear of being detected also is associated with the fear of undergoing hospitalizations and full checkup and this and that and all. So there's ignorance is the bliss is their motto.
Yeah.
And that I think is wrong. But these are the three categories of the people who do not report in time to the hospital.
So, and it is late by the time they report in many cases.
If the patient is able to reach the hospital,
So,
as I told you, 50% of the people are not able to reach the hospital because the catastrophic collapse and death takes place in 50% of the cases within first 1 hour from the onset of chest symptoms. Now, this is those remaining ones who are fortunate to be able to reach the hospital. If they reach within 1 hour, and big hospitals like Jaslok and others, if they are able to open up their artery within that time frame, then almost 80% of them do not show any evidence of heart attack at all in 3 months' time. The recovery is so very complete. And we are therefore very much concerned that this message should go in a little more intensive way in the society, to the society members, that howsoever mild your symptoms are, and howsoever non-specific your symptoms are, and you might insist on the family members to take you to the hospital, and you may turn out to be totally normal, and you feel that you will be a laughing stock in front of everybody, and you feel that you are crying wolf. People will tell you like that. Cry wolf.
yeah.
Cry once, cry twice, cry thrice. Every time cry wolf. But don't miss out. Let doctor tell you that this is a false alarm.
Right.
So we are not bothered. Don't worry.
Yeah.
We are not embarrassed because you came and disturbed us in the middle of the night. No. Do that.
So,
But I don't want to miss out a single heart attack just because it's misguiding symptoms.
no, thank you. As you said, in my one question, I asked three questions, and the third one was, what do I do if I see the numbers that are elevated? How do I make sense of it? For example, if I see elevated cholesterol, one of the things that we are suggested is either looking at nutrition, and I'm sure you have a very good view on it, so I want to request to go through it, but also at times, say, statin is suggested. But in that case, what happens? They're like, oh, how do I take statin? I'm in absolute denial that I'm still not there. Once I start the medicine, I can never reverse it, etc. What would you suggest here?
You will never be able to stop it.
So,
That's the fear really is expressed by many patients,
Sir.
especially the young ones.
Sir.
Well, let me explain. Yes, there could be some side effects due to statins, especially liver enzymes do go up. Muscle aches and pains also happen. Destructions of the muscle cells also could happen in major, minor or moderate form.
So,
And these side effects very often are mild and self-limiting. So if you pursue the treatment for 2 or 3 months, maybe enzymes settle down. However, there are alternate methods also. Some new methods have come, evalucumab and others, which I think inclisiran, which I think are injectable statin, LDL lowering or LDL preventing effect on the blood cells, and especially the blockades, etc., affecting favorably. They are available and they can be used. And now you asked another question that nobody likes to take medications because what do you mean? Am I sick or what?
Yeah.
So there's a stigma that they feel from within.
True.
But I would say the side effects of the medications or a stigma are far, far less harmful than what LDL can do when it is neglected. So when the threat from the disease like heart attack is major, I would not mind the side effects.
So, very, very true.
I'll try to postpone, prevent, and give suitable combination of medications so that does not have side effects. So that could work. Yeah.
I remember a conversation with a friend of mine when I spoke with him. So he had very high LDL, and he said, I have just changed my oil. And he said, now I'm eating a healthy oil, so I do not need to go through having this statin. And nutrition, I've been seeing that people say, okay, at best what they will do is change their nutrition. Is that true that it's going to help me reduce my cholesterol levels?
To an extent, it does. I mean, to give you an example, we have 3 types of oils: monounsaturated, polyunsaturated, and saturated. You remember Hindustan Liver used to make ghee like dalda, and that is a fully saturated oil.
Yes, sir.
And that I think is very harmful. Sorry, and that should not be consumed at all. On the other hand, olive oil and all which are monounsaturated, and some other oils which are polyunsaturated, you can, whichever to your taste, you can use that. It does help, but as I mentioned to me, that brings me to a point of lifestyle.
So
that apart from diet is a part of lifestyle. And I would say, because we all must keep in mind, we all must preach, we all must practice that lifestyle is not the treatment, it's a way of life. So, elephant does not eat non-veg food, and tiger does not eat grass.
Yeah.
We are derived from a monkey race, and therefore, monkey being a vegetarian, I think the lifestyle, after 23 unsuccessful attempts, the tiger is able to get the prey. So how much hard he has to work to earn his food.
Yeah.
We all guys are served on table.
Yeah. Just order it.
Just order it.
Right.
So that I think is the problem.
Yeah.
That is the fundamental problem.
Right, sir.
Potato couch syndrome. The boys and girls are watching TV and enjoying Poco or God knows what kind of programs they come on.
Yeah.
And they're munching fast food.
Yeah.
And they're not overweight, they're obese.
Yeah.
That this is the problem.
So,
Yeah. So again, I repeat, lifestyle is not the treatment, it's the way of life.
right.
We have to live that way.
Right. Such a great macro view, sir. It makes so much sense. And while nutrition makes sense from a cholesterol point of view, as we were discussing earlier, nutrition is not the primary reason for cholesterol to be going up, for that matter, correct?
It's not the only one.
Right, sir.
That's not the only one.
Sir.
There are inherently your genetic predisposition or your internal metabolism, which is primarily controlled by liver. That I think varies from person to person. So some people eat normal food or sometimes even liberal in intake of cholesterol-rich items, and yet their cholesterol does not go up.
Yeah.
So it's to an extent. But you come to know that your cholesterol is high, then you cannot afford to neglect it.
Right. Got it. And sir, how exactly these interventions, whether statin or anything else, how it actually helps me with managing my plaques? Is it converting the soft plaque into hard plaque? Is it reducing the arteries blockage or anything else?
Well, I think you're reading a lot about cholesterol, looks like. Anyway, I'm happy.
Sir.
Yes. We talked about soft plaque,
Sir.
which rupture with rise in blood pressure and pulse during exercises, too rapidly, too high. And the product of blood pressure and pulse is so high that it makes the plaque to rupture.
So
I'll tell you. It's a little bit medical term, but try to simplify as much as possible. Lipids covered with a thin cap makes the plaque.
Right.
That thin cap is vulnerable to rupture, because it's thin.
Yeah.
When the double product going up and rupturing the plaque is that plaque which is very rich in lipid and it is covered with a thin cap. how do I change the composition of my plaque? So statins, they make the plaque hard and therefore less prone to rupture. So therefore, I presume, and a good management with statin of this kind of soft plaques will prevent so many possibilities of rupture of such plaques, and therefore will be helpful in preventing sudden cardiac death, which you started our discussion with.
So,
and that I think can be minimized.
Great, sir. The runners are going to be towing the start line soon. And by listening to this conversation, they are going to be curious to see and ask, should they go through certain tests when it comes to cardiac health? And when they see the tests, how do they make sense of it? Would you suggest, or will it be too generic, forgive me if that is the case, whether runners of any age group when they are running here should go through certain tests as a baseline test?
Absolutely.
So,
absolutely. Any very unusual physical activity without being totally clearly certified that you are fit to undertake that one, I would be very upset and reluctant to allow that to happen. Therefore, anyone who wants to run half marathon, I would say merely questionnaire or absence of symptoms is not sufficient. So he has to undergo proper investigations, and if he's really an avid runner, I would not hesitate in recommending to him even a CT angiography. So this I would be insist. So that's a specific population with specific question.
right, sir.
Okay, it is undertaking that kind of a thing.
Right.
So that I would certainly be.
So,
I would recommend very strongly that they should undergo a very thorough and meticulous check before they participate.
Got it, sir. Makes a lot of sense. One last question, and this came from one of the listeners. We had posted it online asking them for questions. That was, he received a blood test, which he does every year, and he sees certain bold numbers. And when he looks at lipid profile, so long as his overall number is correct, he's not bothered, is what he was saying. Is that the right way of looking at the numbers?
Wrong.
Sir.
Is like this. The laboratories, they make the normal range as per their concept. That is not derived from the data that we have obtained as to what is the protective level of LDL cholesterol in relation to heart attacks in future to happen.
So,
all right. That level, in my opinion, is 70 for people who are enjoying normal health. In other words, they have never shown any evidence of heart disease in the past, like a person who has never undergone bypass, person who has never undergone a heart attack, a person who has never received a stent. For them, 70 LDL level is good. Although little strict I am, 100 or below is okay, but 70 is good. But people who have exhibited an evidence of past heart attack or evidence of coronary disease, let me put it in general, there the cholesterol level should be less than 50. And lower, the better. There are some doctors who might want to keep it 40. And it should be consistently low.
So,
yeah.
Got it.
Yes.
And triglycerides is not something that I should be using.
It's a minor risk factor, but there are people who have a primary high elevation of triglycerides. And apart from that, two things which elevate certainly triglyceride level is uncontrolled diabetes and alcohol. So these two things, so people who have high level of triglycerides, they should refrain and take care that their diabetes is well controlled and they don't indulge into alcohol.
Sir, awesome. It's great that the runners are getting out and going to run. It's great they have trained, but it doesn't give them a free pass to be ignoring their health, and being aware is a great start line. Is there any other message, sir, that you would like to give to our listeners who are going to be running very soon?
Yes. It is so easy to follow a healthy way of life. So easy. You don't have to sacrifice anything. Once you have learned intellectually and intelligently how to moderate I'm not saying that you should not go and eat kulfi or pani puri once in a while. Surely, exceptions make the rule.
So,
And I think, therefore, as long as you practice moderation throughout your journey of life, you are done well.
awesome. Sir, no one better than you to tell about longevity and staying fit. How have you kept so fit? Now more than 8 decades of just charging and impacting positively to our lives, sir. How you have just been going and what are your secrets?
So, your question is based on one presumption,
Sir,
that although externally I'm looking fit and fine, to all onlookers, my friends, my colleagues and whatnot, I'm not very sure internally what is happening. But let's talk about the fact that whatever I'm being able to carry out I work still about 14 hours a day. And I think the most important thing, in my opinion, out of all the factors that we are considering, the two very important factors are the diet, in the sense that moderation, weight.
so
Diet is automatically related to weight, because if your intake is more than your needs are, you gain weight.
yeah.
And second thing is the stress. Stress management is important. And probably maybe genetically I'm destined. I have a history in my family of longevity, so that might be helping me. And honestly, if you ask me this question, I don't know why am I so driven at the age of 84, 85. I'm so driven that my colleagues feel very encouraged and to do hard work, and they're getting inspired. That's my fortune. They're paying compliments to me. But this is probably the secret, that moderation. Don't allow your weight to go up. Like at the time of my wedding, I was 55.5 kilo, and today I'm 56.
Wow, wow. Sir, what a fantastic story and such beautiful nuggets of information that is going to go and be very helpful to our listeners. Thank you very much, sir, for being with us today. And we will be reaching out to you after the finish line that all of us have been very successfully done the race and are healthy.
Thank you, Vikas, and I hope what we discussed is helpful to people,
Sir,
and to helpful to people to live a long and healthy life. Then I think this interview will have immense value.
sir,
Thank you
indeed,
so
sir.
much.
Thank you, sir.